history of ear discharge, and on otoscope examination, perforation seen in the anterior-inferior segment of tympanic membrane. Comment on the Rinne's finding in this case. So this is kind of question nowadays they're asking. So first of all, interpret the picture and the patient over there. Now this is the case of course, the Safe CSOM or tubotympanic CSOM, because there is a perforation in the pars tensa of tympanic membrane, and that a typical, clinical, examination finding on the tubotympanic CSOM or Safe CSOM. And that would lead to, of course, conductive hearing loss. And if you remember, in conductive hearing loss, the tuning fork test finding will be, Rinne is negative in conductive hearing loss. So he's asking comment on the Rinne's finding in this patient. The answer is Rinne will be negative. Answer is B. I hope all of you could understand that. Let's have a quick revision of the tuning fork test, this thing. There are 3 tuning fork tests. First one, Rinne is comparison of air conduction and bone conduction. In normal people, air conduction is better than bone conduction. And in conductive hearing loss, bone conduction is better than air conduction. Rinne negative is a very, very important question. Always, and this question also is Rinne negative because it's a conductive hearing loss. And these two are always reverse of each other. Okay. So sensory hearing loss, the Rinne will be positive. Positive means AC is better than BC. Now, Weber test is when you keep the tuning fork in the center of the forehead, where you hear the sound. In conductive hearing loss, Weber sound is heard in the poor ear, and in SNHL is heard in the better ear. Poor ear means ear with the hearing loss. Okay, ear with the disorders. Now, ABC, absolute bone conduction, ABC is decreased in sensory neural hearing loss. So 3 points to remember for the tuning fork test are Rinne negative means bone conduction is better than ear conduction. Okay. And that's a feature of conductive hearing loss. So never forget this finding. Rinne negative is conductive hearing loss, BC better than AC. Number 2, Weber heard in the poor ear means conductive hearing loss. And number 3, bone conduction poor means sensory neural hearing loss. So there are 3 findings over there. So guys, if we have like 3 questions over there, now tuning fork test very commonly asked question, you know that if Rinne is given negative, and Weber is heard in the poor ear, we already know the answer. It's conductive hearing loss. Let's make reverse of this. If Rinne is given positive and Weber is heard in the better ear, it is sensory neural hearing loss. CHL and SHL are opposite to each other. But if the question comes like this, Rinne is given negative and Weber is heard in the better ear. If Rinne is given negative and Weber is heard in the better ear, now this is a case of false negative Rinne, and this is seen in unilateral severe SNHL. So 3 tuning fork questions are, if Rinne is given negative and Weber is heard in the poor ear, it's conductive hearing loss. If Rinne is given positive and Weber is heard in the better ear, it's sensory neural hearing loss. But if Rinne is given negative, which means the conductive hearing loss, and Weber heard in the better ear, which means SNHL. So in this case, please mark the answer unilateral severe SNHL, because this is a situation of false negative Rinne. False negative Rinne. Okay. Now, my dear friends, audiogram would be asked to you for sure in some of the question in NEET PG, INI-CET, FMGE examination. There's basic rules are the blue colored audiogram lines are for the left ear. So left ear is always shown with the blue color and right ear with the red lines. So blue lines, these 3 audiograms are blue and they are left audiograms, left ear audiograms. Okay, fine. And you always know any symbol like this, bracket like symbol, these are bone conduction symbols. Okay, fine. And circle and cross are the air conduction symbol. Circle is the air conduction of right ear and cross is the air conduction of the left ear. In normal people, both AC, BC line should be about 25 decibel. Okay, this is 25 decibel. In conductive hearing loss, this is conductive hearing loss, this is normal. In conductive hearing loss, BC is better than AC. BC is normal. Anything above 25 is normal. And AC is poor. And this gap is called AB gap. AB gap means conductive hearing loss. Okay. And in SNHL, both AC, BC are poor. both AC, BC are poor. Okay, very simple, interpretation of audiogram is that if both lines are above 25, it's normal audiogram. If both lines are below 25, it's SNHL. And if there is A-B gap, it's conductive hearing loss. My dear friend, in mixed hearing loss, you will see over there, please see, this may be a question in the examination. Mixed hearing loss mean both, this is 25 decibel. Okay, in mixed hearing loss, both BC, AC line are below 25 and there is AB gap. So in mixed hearing loss, like the question asked in INI-CET this time also, both AC, BC are poor. Poor means below 25 and there is AB gap. So mixed pattern, both AC, BC poor means the SNHL and AB gap means conductive hearing loss. So if both AC, BC are poor and there is AB gap, it's a mixed hearing loss. Please do not forget the audiogram.